Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Well, hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart. Today I have the pleasure of being with my good friend, my colleague and mentor, Dr. Felix Liao. Dr. Liao practices in the Washington, D.C. area, and he's written several books. The most first one I ever read was 6 Foot Tiger, 3 Foot Cage. I recommend that to so many patients. I just had a patient yesterday that I'd given her that book last week, and she came back in, she had read the whole thing, and she's ready to go with all this great stuff that we're doing with patients. His two newest books are Relaunch Your Vitality and Your Child's Best Face. Dr. Liao is I would call him a physician of the mouth, but really the whole body, because what we see in the mouth is a reflection of the whole body. And so he's a whole health focused dentist, just much like I am. I've kind of patterned my practice and a lot like his. And it's just an honor and a pleasure to have you with us today, Dr. Liao. Welcome.
Thank you for having me. It's always delightful to share with advanced and evolved doctors like you, Hal. So, shall I?
Why don't you hop into it, man? I know you got a lot of information and we've got a limited amount of time. So I'll let you go with it.
All right. So Hal mentioned 6 Foot Tiger, 3 Foot Cage. Well, the book is still having ripple effects in the pond, so to speak, and we're just beginning. So I want to talk about epigenetics so that you and your audience understands that you are no longer stuck behind your crowded teeth, your choked airway, and your stunted jaws. We can regrow your jaws regardless of your age, as long as you've been going to the dentist and taking care of your teeth. All right? So isn't that exciting? I call this the earth is no longer a flat view of the mouth and the face and your whole body health, okay? So epi means on top of, like your epidermis, on top of your skin. The outermost layer is called epidermis. So epi means on top of the genes, okay? Something else influences the genes. So CDC's definition of epigenetics is the study of how behaviors and environment can affect how genes work. All right, so we're down to 2 things. What are they, Hal? Behavior and environment, okay? Yep. So let me show you the difference that can make. So I published this case using DNA appliance about 10 years ago, and I am still marveling at the differences made, not because of how great I am, because, you know, somewhere along the way, this patient shows us what the possibilities can be. Right? She was 17 when she came to me. For most girls, they're done developing, right? But what happened in the process and what's in there that we might be able to use for everybody suffering from sleep apnea, TMJ, teeth grinding, and so on. All right, so that's the journey. So along the way, I came up with this term called impaired mouth syndrome. This is a set of symptoms that's associated with having a 6 Foot Tiger, 3 Foot Cage, okay? Predictably, you're gonna have a bunch of problems. So now we have new solutions for these head scratcher symptoms that baffle doctors, dentists, mental health professionals, and owner and operator of every mouth. So this discovery of gravity could lead men to the moon and back. What can impaired mouth syndrome do? And what can epigenetic solutions do? Okay, here we go. Just like we're gonna go on a bus tour and just see what's possible. So this 17-year-old came to me and said, I ground through my night guard the orthodontist gave me 4 years ago when my braces came off. I mean, that's a colossal relapse, right? And I told her, hey, look, your tongue is intelligent. It didn't want to play dead in the back of the throat. So it fought its way out of Alcatraz and created this big open bite, okay? So let's see which way the wind is blowing, where the force is coming from, and let's see what we can do to basically relieve this struggling tongue from the cramp. And the answer is to redevelop, regrow this purple bone. And as Dr. Hal and my common mentor, Dr. Dave Singh, has proven that this is more than possible using this device, DNA appliance, way back in 2011. He was the first to show that you could improve an airway 58% using this device in a severe sleep apnea patients in an adult, okay, not just kids. So I came across this study. I said, okay, here's a perfect opportunity. And I asked the lady if she wants to do it, and she said yes. And so here's what happened. We took her from the upper left image to the upper right image using this. And in the process, her face changed for the better. And we'll come back to visit that shortly. And in the process, we tripled her airway volume. That is the tube that transports your oxygen, okay? We tripled that airway volume, and we more than doubled her minimal cross-sectional area. Okay, minimal cross-sectional area is where the collapse in the airway happens during sleep apnea. So you definitely want that to be as open as you can. So on the left, she was in the choke zone, and the right, she was on the wide end of the color scale. Okay, so yes, we duplicated Dr. Singh's study and more. And the more part is the facial appearance part. The entire dental facial skeleton changed. So how do you explain this? Okay, the way I see it is that this is way more than just widening the jaws, because dentists has been widening the jaw since forever, right? But what happened here? Well, this is called an epigenetic difference, okay? So we can look at it this way. This is my view now, 10 years after, thinking about this case and what it's trying to teach us. When she went to the orthodontist, she was maybe, let's say at age 10, and she is 19 here. So she was in treatment for 2 or 3 years with the orthodontist. And by the time she got off braces, she was 14. By the time she came to me, she was 17. So by the time she went to the orthodontist at age 10, she was maybe 50% developed. When she went to the orthodontist, she maybe was 60% developed. Here, she's closer to 90%, having her double helix DNA genetic potential expressed. And how we did that is with environment change and behavior change, according to what CDC says. Now, if we get that right, we can change everybody, as long as they have sound and healthy teeth. Would you agree, Hal?
Oh, absolutely.
This is the key to uncrack the code. That's why I say you're no longer stuck, just because she is the seminal case. Yeah. Now, with Dr. Singh's help, I got this case published in a peer-reviewed journal. And the most important part of this is this first sentence, okay? Evidence suggests that sleep bruxism, that means teeth grinding, is centrally regulated. That means it's not regulated in the mouth by the dentist, it's regulated in the brain by the patient's survival intelligence. And that the highest risk factor associated with sleep bruxism, that is teeth grinding, is associated Most likely it was obstructive sleep apnea. So this means what? Every time you have teeth grinding, you need to think about choked airway and sleep apnea. Okay, now we look at this completely differently now, right? As a dentist, we used to say, okay, you're stressed. The teeth don't fit together well. That's the view that the earth was flat. The new view is that the earth is round and therefore the logic applies different, okay? So it turns out teeth grinding is just one frame in a movie. The movie is called Airway Obstruction During Sleep, okay? Now, what's the dentist's role in this? Well, one, you have to recognize that when you're grinding your teeth, you're not sleeping, okay? This is what the EEG study says. EEG is just like your EKG, your heart tracing of your electrical events. But here's a big king. The heart rate spikes 10 seconds after you grind your teeth. So now think about it. You're sound asleep, you're warm, you're dark, it's quiet, your brain is shut down. What would cause you stress? I can only think of one thing. Your airway collapse. And your body, wait, we got to do something to stay awake and stay alive. Okay. So when the airway is closed, your body goes into a life or death, fight or flight reaction. Okay. And so naturally, the blood pressure increases with teeth grinding and it surges by 20 to 25%. That's a major stress, right? So that's why people who grind their teeth never wake up refreshed. And you do that for years, and the dentist says, well, you're just stressed. No, we have evidence showing that teeth grinders have worse airway. Okay, worse airway is reflected on this color scale on the red and the black end, as opposed to the white end and the blue end. Okay. So this is a horrible airway, and sure enough, she was a violent teeth grinder. Better yet, okay, that you can understand why teeth grinding is an airway event, because this study shows that during CPAP titration, okay, that means that they're trying to determine how much pressure it takes to blow air past this choke zone using CPAP. They found that there's a complete eradication of teeth grinding when enough pressure is put through this choke zone. All right, so this shows that this is not a dental problem, but an airway problem. Yeah. Okay,
the teeth are the victims.
Teeth is the roadkill, yes.
Yeah,
okay.
that's the
roadkill. The struggle to stay alive is front and center. Right. Preoccupation for the body. Okay, so teeth grinders are very have their own set of symptoms, and that set of symptoms is part of a larger symptom set that I call impaired mouth syndrome. So teeth grinders commonly have these symptoms. They wake up tired, they have morning headaches, fatigue, aches and pains, jaw clicking, anxiety, depression, brain fog, lousy memory, high blood pressure, and multiple dental troubles. That's just teeth grinding. What else can an impaired mouth do? Okay. And I think David Satcher, the US general who issued this report way back in the year 2000, was brilliant. He made this incredibly wise statement that oral health is more than healthy teeth. And dentists have been, focusing on healthy teeth, healthy teeth, healthy teeth, healthy teeth, and they forget the big picture. Well, it's not their fault. It's dental school educational focus. Just focus on trees, miss the forest, miss the mountain, miss the terrain, miss the whole world order on which the body is organized. Okay, so when, for example, a natural tooth fails, we can offer implants. Well, what happens when the implant fails? How, what do you do when implants fail?
It's denture time or bridge time.
Sorry, patient.
Not much you can do.
Sorry, patient, right? We don't have any other answers. So I don't understand the big push on implants when you have this choked airway staring back at you and signs of teeth grinding looking at you, okay? So from that one seminal case, we can extend the logic all the way to the end of dentistry's failure, all the way down to a month of implants and still failing. All right. This patient is a nurse. One thing about a nurse is that they're very good at executing doctor's orders. When her dentist says, oh, do this crown, do this root canal, do this implant, she did it all. How much money do you think she's put into this mouth?
Yeah, a small fortune.
You can buy a house, okay?
Yeah.
All right. So I got called in after the third time she failed this bridge. I mean, it just didn't stay on. Okay. And here's the reason. She is bruxing all the new teeth off so that she could breathe. And the dentist didn't understand that. All right. So this study is done with one dentist doing more than 10,000 implants so that it eliminates operator error. It found that in non-bruxers, the failure rate is just under 5%. And in bruxers, it's 13%. So that means that you have 3 times the risk of failing your implants if you're a grinder compared to a non-grinder. So I don't know about you. When I buy a car, I don't want to have a lemon. If you're a grinder, you're very likely going to end up with a lemon for implant failure. Okay. So our new rule from this case, thinking about epigenetics, is A, B, C before D, right? Just like the alphabet. Alignment, breathing, circulation before dental work, doctor. So this represents a huge paradigm shift for me, that it's not a night guard. This is what we're taught in school when the earth was still flat. It's the new paradigm, like Dr. Singh taught us. It's the airway. And that the jaws is what determines the airway when the airway is being formed. Once the adult gets Texas-sized pot belly and triple chin, this gets compounded and aggravated. All right. I've been to Texas many times. One of my favorite things to do is visit the supermarkets and take pictures of the food offered there and the size of Texans there buying. Okay. So this is how we explain this. Okay. The epigenetic difference is that we can redevelop somebody regardless of age. Now I'm going to jump forward to some adult cases. Okay. This is the same dentist. She happens to be Canadian. Week 1, right after she took my course, month 3 and month 12. All right. Same person. What happened to the face? You can't just say, well, the appliance did that. No, we have a whole set of protocols. One of them is a bone building diet. Okay. The bone building diet I'll go into shortly. But basically it's green smoothies and bone broth. Okay. The two of them combined together provides the precursors for making bone. And that's the basis of growing the maxilla and the facial bone structure. And that's why somebody looks like more beautiful. Besides, this thing heals the leaky gut. Okay, so the story of this dentist is that she had severe TMJ, lots of chiroacupuncture, massage, even trigger point injections, and she also has fatigue, teeth grinding, and restricted airway. Well, dentists don't even know how to treat themselves and heal them because that's not what dental school taught them. All right, this is not a failure of the dentist. This is a failure of the system. This is a failure of the emphasis strictly on cosmetics and not seeing the root cause of why you need cosmetic cover up.
Yeah.
And that's no more and no less cover up. Okay. All right. So what's the approach? Well, let me tell you what this difference can make. Okay. So we use this thing called subjective units of distress for each symptoms. If 10 means you're rolling on the floor or you can't get out of bed, you're totally dysfunctional, and 0 is nothing, where are you? And the patient rate themselves on this very accurately. This is actually used as a psychological tool in assessment. So she came in with 9 symptoms: jaw pain, sleep quality, right hip clicking, okay? Mouth breathing, headache, back pain, daytime sleepiness, brain fog, poor digestion. Okay, this is your dentist. All right, and she's no different. Everybody is a standard issue North American, okay? We eat similar food, breathe similar air, drink similar water, okay? So she came in with 57 total subjective units of distress. So fast forward 10 weeks later, she went jaw pain 8 to 2, right hip pain 6 to 0. Okay, the only thing she did during that time was wear the mouthpiece and ate the Tongdiao diet. At the end of 10 weeks, her total subjective units of distress is 11. That means that she improved 46.
That's amazing.
Okay, 46 divided into 57 is 81% improvement. So here's the big revelation, right? This process involves no drugs, no shots, no drills, no pain. You don't even have to drop sweat on the gym floor. Right? You can improve somebody's overall symptom set across the medical, mental, dental, and emotional front, 80%. Okay, so this brings me back to the concept called a holistic mouth. Okay, because we have forgotten what the mouth does. The mouth actually is a multi-purpose organ. It's kind of like your, football player who can play offense, defense, and kick and punt. Is your MVP of all the organ systems. We tend to think it's the brain, it's the heart. No, it's the mouth that supplies energy for the brain and the heart to work. All right, that's why the mouth is part of the head. You can live without the rest of your body, but you can't live without this first limb. And the center of first limb is your mouth. And the center of your face is your maxilla. So when your maxilla does not work, which is your upper jaw, then you got a problem. The problem is called impaired mouth syndrome. That's because the mouth participates in at least these functions. These are what we call physiological functions. What you need in order to, 1, survive, and 2, when you do it well, you can thrive. These functions are alignment, breathing, circulation, digestion, energy, and sleep. So A, B, C, D, E, S. All right. So if they work, you'll have wellness. If they don't work, you have impaired mouth syndrome, which I define as a huge set of medical, dental, and mood symptoms from the jaw's failure to thrive. All right, so fast forward, let's look at this. This is a medical doctor, a microsurgeon, highly trained, okay? She got to the point where she had acid reflux from sleep apnea, and she had to buy herself a new set of teeth, and she still ended up with pain, okay? And she got talked into doing jaw surgery after that, okay? And guess what? She said, I end up with a nicer profile, but I still have all these symptoms by the time she reached me, okay? So this is a physician's case demonstrating that all the dental treatment she bought failed her to the tune of 99 subjective units of distress out of 110. So basically, she scored a 9 out of 10 for every symptom listed here. Migraine, anxiety, teeth grinding, snoring, neck pain, shoulder pain, back pain, jaw pain, daytime sleepiness, brain fog, and poor digestion. This is a microsurgeon operating on you. And her medical and her dental colleagues cannot get her past these. So fast forward 4 months, 12 weeks, and we had to repeat this survey on herself using the subjective unit of distress scale, and went down to 30. That means she improved 69. Divide 69 to 99, you get 70% improved. Okay, so you see now that we have consistently get 70 to 80% improvement once we do this. Okay, so
that's the biggest thing here. We love to look at objective measurements, like your airway volume went from this to this or that to that, and your minimally restricted area increased so much. But this is what's really important: their medical improvement. And
yeah,
I talk to anybody and say, in 6 months, I can improve your give you a 70% medical improvement. Are you on board for that? And every single one would say,
yeah, no pain, no shots, no nothing. Okay,
yeah.
So in paramount, we can reasonably say that in most instances, responsible for 70 or 80% of the patient's presenting symptoms. That's how big the mouth is in whole body health. And yet it's not taught in dental school. I had to hack my way out of the jungle, thanks in part to Dr. Singh's research. And, thanks in part to a lot of my patients' willingness to try out something new based on just, I got one North Star to sail by. Are you willing to come with me? And they really contributed, like this, young lady's case and these two doctors' cases. They contributed a lot to our understanding of why adults end up with shoulder and back pain and fatigue. It's because when they're young, the dentists are not trained to see, okay, why you need to pick up these clues. Instead, they just delegate any kind of crowding to the orthodontist, and the orthodontists do their thing, which we can talk about separately, because I've also acquired some insights into the consequences of conventional care in dentistry, which is not to say I'm against it. I'm saying that cases like this gives us pause, right? It makes us ask, well, what didn't work before and how can we do better? And we have figured out how to do better part. So I can tell you that we've cracked the code on how to bring on a child's best face. And you do that by recognizing that, hey, look at the feet. Look at how the arms hang, okay? How the body works starts from the top down. So when your maxilla is off, okay, the rest of the body pays a price. This is absolutely not on the national board and the licensing exam on the dental school to get your dental license, right, Al?
Far from it.
Yeah, okay. So this is a big picture, okay? If you miss this, this kid is stuck for life, okay? In a milder version, guess what? All the adults are trapped in this impaired mouth syndrome, undiagnosed since childhood. Because when you were growing up, let's say you have these symptoms, and you have fatigue, you have sleep. When you were growing up, you have symptoms that the dentist just was not trained to see.
Yeah.
So the question is crowding the result of too many teeth or too little jaw? Right? So you got 16 kids on the sidewalk and a bus shows up with 12 seats. What's the wrong? I mean, do you call for a bigger bus or do you stuff everybody into that smaller bus, right? So here's the choked airway. here's crowded teeth, okay? Anytime I see crowded lower front teeth, I know that the upper jaw is too small and the airway is underdeveloped, all right? So this is the big North Star for me, okay? Stanford Sleep Center is the premier research, sleep research and airway research center in the world. They came out with a conclusion in 2012 that pediatric obstructive sleep apnea in non-obese children is a disorder of orofacial growth. There is the secret to all these problems that we're talking about: teeth grinding, airway obstruction, sleep apnea, fatigue, pain, you name it, 70 to 80% of it is related to this.
Yep.
Okay. So this conclusion also supports this study by Dr. Singh way back in 2009. Okay. He worked with University of Malaysia Dental School, and they measured the palatal width of the upper jaw in apnea and non-apnea patients. The difference is only 7%. All right. You just need to go from a 6-foot cage to a 4-foot cage, 5-foot cage, and you've got sleep apnea.
Yeah.
Yes. Your brain doesn't tolerate a 3% drop in your oxygen supply. All right. So the jaw growth is the key to everything. Okay. So here's a 61-year-old. She's got low back pain when she came to see me all her life. I looked at her airway, and it's horrible. And I looked at her mouth and I said, you've been going to the dentist for 55 years. And this awareness is just not in your dentist training. So that's why you hurt for 55 years, assuming that she started going to the dentist at age 6. Okay. So what's the problem? She's got crowded lower teeth. That means her upper jaw is underdeveloped. That means her airway is choked. Now, what if we recognize impaired mouth syndrome in both adult and children, and we were able to grow new eyes from just seeing teeth to seeing the whole body, including the mouth, the content that includes the tongue and the jaws, and the jaw joint to see the big picture. I see the whole patient globally. If we could see this, just one view, you look up the nostril from under the chin, and you can see a lot of things that's wrong with the patient. Okay, the eyes are not even, the nostrils are not symmetrical, the lips are incompetent, means there's no lip seal. That means he is a mouth breather as a result of nasal obstruction. That means that he would have chapped lips. You're a patient who says, oh, doc, you can stop, but just let me put my chopsticks on first. Well, there's a big red flag, okay? A big alarm bell is going off in my head, and say, okay, you're telling me that you're nasal obstruction. Anytime you have stuffy nose, you had to mouth breathe, it's gonna affect your mouth. The body is that connected, even if the doctor's mind is not able to connect all these dots. So here's a 14-year-old compared to that 61-year-old, okay? Same exact pattern. Choked airway, low back pain, and crowded lower front teeth. Now we have the opportunity, with our new awareness that the earth is no longer flat, we can rescue this patient and turn him in a completely opposite developmental track. Okay, so got lots of other adult cases, but I just want to show you that if we understand this, we can really make a big difference. You can turn an average duckling in a preteen into a full-fledged swan. And this is not just for looks. This is health, function, and social. Okay. So mom was basically a dentist who sat in my class being trained as an AMD, and she found out about how I see things, and she said, I got to get my daughter off braces. I said, okay, tell us the story, and I'll show you the story shortly. But basically, I want to focus on just the epigenetic difference that you can see with your own eyes, even if you're not a trained doctor, dentist, or healthcare professional, okay? Every parent who look at this thing can say, okay, this is a positive difference. So she had just had braces taken off. And this is 11 months later, okay? Just like the opening case, the tennis player, right? What happened in this process, right? You can't just say it's the appliance. Yeah, we use my appliance. I have my own design, but that's not the important part, okay? The important part is the epigenetic and the bone building diet. That magical combination is able to literally trigger the gene expression that is already encoded in the double helix DNA that each child inherits from the parents. So this is what she looks like now. Wow, 2 months ago.
Wow.
Okay. No braces. All right. Here's the airway in 2 years. We have a 50% gain in the airway volume from 16 to 24.5. Okay. So it's a little jumbo here, but here's 15.9 and here's 24.5. Okay. We have a nearly 100% gain in the minimal cross-sectional area where it matters. Okay. So this is a developing teenager. We tend to think that, oh, nothing can happen with them. Nature will take care of things. Well, I beg to differ. We need to pay attention because if you missed it here, the kid is stuck for life.
Yep.
Until somebody who knows, like Dr. Hal, comes and make the diagnosis because they got the recognition, they got the awareness, okay? So this is this preteen's symptoms before treatment. Sleep eruption, 8. Snoring, 8. Headaches, 9. Inability to focus, 10. Vocal stress. She's training to be a soprano. She couldn't hit high notes after braces went on, okay? Fatigue, 10, okay? So out of 6 symptoms, her average was 9, okay? Fast forward 20 weeks. Sleep disruption, 8 to 1. Snoring, 8 to 2. Headaches, 9 to 0. Vocal stress, 9 to 2. Fatigue, 10 to 2. The total difference is, again, 80%. I find that the worst cases get about 70%, and the good cases get about 80% consistently. This is just, you know, it's one of those mathematical patterns that we see. Oral contributions to systemic symptoms, okay? Again, no pain, no drugs, no sweat. Mother is a naturopath. Mother is now a trained airway mouth doctor. Mother is also a home school teacher for this girl, okay? And guess what? She just won the national speech and debate championship. She's #1 in the country. And afterwards, people went up and congratulated her, and they said, my God, where did you get that smile from? This is the genetic potential in everybody, okay? So if you're 65 years old or 35 years old, it's not too late, although the difference won't be this dramatic, okay? I'm convinced that the older you get, the potential is still there, but the difference is not going to be nearly as great, okay? So I want to just show you that this work involves no drilling, no pain, okay? Any drilling is done outside the mouth, and the patients love it in here. It's like dropping your shoes off, get a repair instead of having your foot surgically operated, okay? Yeah, so it's all joy and no pain. right? So we have lots and lots of pain cases. I just want to show you one more thing before we conclude for any kind of Q&A that you might want. So, we dentists tend to think, oh, okay, we do our thing and the rest is medical doctor's business. No, I take the attitude that if this is my patient, then, well, if you're my patient, then your problem is my problem. If it's beyond my scope of practice, I will do my best to help you find an answer. I will refer you to someone who I think can help you, okay? And so we take a whole health mindset that accepts that everything is connected, and that in this whole body connection, the mouth is first and foremost. And then from there, everything else follows, okay? So to demonstrate that the mouth is connected to the feet, I had this lady patient's husband hold my iPhone over her ankles. I had my thumbs over the balls of her ankles. I had her bite her teeth together and her midlines are off. She had gorgeous teeth. She never had any cavity, never had any braces. She just grew up this way. And her leg lengths were not even. When I put my appliance in, her leg length instantly became even. And the husband said, if I didn't see it with my own eyes, I wouldn't believe these photos. Okay. It's really that amazing. Okay. And so here's what happens. You can see that people with midlines off, upper and lower dental midlines off, they'll end up with pain problems down the postural chain. If not the neck, then the back and the hip. This was just before the pandemic lockdown. Her hip replacement surgery was canceled, and she's left with this hip pain that keeps her up awake 2 hours at a time. And then she sent me this emoji. Hip, hip, hooray, I'm pain-free, I can sleep through the night. All right, so we have great joy. We have endless number of these cases. We can make pilots fly and pass their exam to renew the FAA license again, okay? Here is the average AHI. CPAP basically can monitor your sleep status every night. And for the whole month of May, he averaged 2.3. Okay, so he's clear to fly.
Yeah.
Yeah. Anyway, we got lots and lots of these cases, and I'm happy to share with you in future episodes. Yeah. I know you need to go, so.
This is amazing, Dr. Liao. I do have a couple of questions because I know our viewers
Sure.
want
to ask. Yeah, fire away.
Doctors and patients alike. You showed the young lady. I love this diagram, by the way. This is amazing. You showed the young lady. You did point out that adults, the older you get, you still have that potential of turning off.
You do.
And reversing some of these things. It's just that you're not going to get as crazy a result as you would when you're 16, like she was. Right. But the appliance is applied to both the same way. Am I not correct? The treatment is the same, whether you're a child or whether you're or like a teenager.
Yes.
Or...
Yes, the principle is the same. The treatment philosophy is the same, but the rate of gear turn is different.
Yeah.
Because a senior's biology is different from a teenager's biology.
Right.
Okay. Yeah. And adults who had teeth taken out, they always fare worse. I don't care what the orthodontists say. From the owner sufferer standpoint, it's always worse. So I just want to show you an example about age. This is myself. Okay. This is myself at age 61. This is 10 years ago. Okay. You can see that my facial profile changed a little bit, but not like that tennis player. Okay. So I went from a class 2 profile to class 1-ish. But in the process of doing this epigenetic approach, I more than doubled my own airway. And I would submit to you that this is what your retirement insurance policy should be, not that card.
Yeah.
So your body's ability to renew itself night after night.
How long did your treatment to go from before to after? How long was that?
Mine took 2.5 years. I find that about 30 months, plus or minus 6. So anywhere from 2.5 to 3.5 years, depending on your case severity, and obviously patient compliance. Because once you give your treatment plan, it's like a coaches draw up the game plan, right? You hand it over to the player and it's up to them to execute and win.
Yeah.
Okay. So I have 20% of the homework to do, and then 80% is up to the patient to execute.
Right.
So I cannot emphasize that this is not an automatic. This is not a given. The patient must comply. Yeah. But the difference is that you can drive your own outcome.
Well, Dr. Liao, this is amazing. We're going to have you back on very soon because you've got too much information to leave it in one episode.
Sure.
But I do appreciate everything that you've done for your patients and for our profession. It's an honor to be a friend, a colleague, and a student of yours. So I want to thank you for that. And as we do on all of our episodes, we end with our guests. Maybe not your favorite song, but a song that you picked for us to end with today, and tell us what that is and why you picked it.
Okay, so it's called The Long and Winding Road because, this journey, we had no idea what's ahead. We just know that something is not right, and we had to do something about it because that's what Dr. Hao is doing. He's been on a quest. He just told me he wants to take the training because he is that driven by this journey. And so the long and winding road takes each doctor in their quest for truth, for solutions for their patients. So the long and winding road by the Beatles actually applies in this case.
Great. Fantastic song. That was a great way to explain it too. So Dr. Liao, thank you so much. We'll have you on again soon. I hope you have a great day. I'll be in touch with you to talk about some other things.
Sure.
It's been a real pleasure.
Yes.
Thank you very much.
Likewise here. Thank you.